Hey guys, it's me and it's Bruiser here. I wanted to do a it's so distracting. I want to do a quick update for you guys. I needed to update you guys after my last couple doctor appointments for the cancer checkup. I don't think I mentioned after the biopsy, I just did I don't even know how many numbers of biopsies I've had for the cervical treatment. So I basically did my pap smear. I told you guys the doctor said I actually got two levels down on my cervical cancer cells, which I thought was amazing. I was like, wow, I've been trying to heal myself all natural. I've changed my diet. I've changed my life. I've been detoxing, fasting, supplementing. I'm eating the most healthiest, nutrition dense, vegan, plant-based foods. Taking everything you can possibly do, tons of water, just really taking care of myself, CBD, everything I've possibly been doing. And I've been doing that for 3 months, consistent, nonstop, research every single day. I have not slipped up. I have not had a cheat meal. I have not done anything wrong. I've done everything on point because my life depends on it. So when I got my test back, the doctor was pretty like, wow, like your levels have gone down. I still have cancer cells. There's no way to get all that out from surgery. Also, I wanted to preserve my cervix as much as possible and take that risk because I do want to be a mom. Other than for him. I want a child. He's my child, but it's not the same, you guys. Look at him, look at him. He's a sleepy boy. So yeah. Anyways, so I got 2 levels down, which is great for 3 months of natural healing. No chemo, no radiation, no medications, all natural. And I think that's pretty damn good, you guys. But out of precaution, my doctor wanted to make sure and get more samples of areas of the cervix that looked questionable. I've been healing pretty decent. My cervix has been healing after surgery and it's clearing up more. It's looking a little better, but there's still a couple areas. My doctor was like, let's take some biopsies of these tissues to get more deeper in the cervix to see where we are at cell-wise. So those tests came back. And it was still similar results, all in all, but she says it's still at a level where she's not comfortable with. It's at a level where, I don't want to go into all those details, but where she thinks that I should still be overlooked by the oncologist and that OBGYN department, there's only so much they can do. They can just track it. They can help monitor. I've been doing pap smears every 2 months. Well, now it's probably going to be a monthly thing, maybe, depending on what the oncologist says. I'm a little nervous. I'm going to be honest. I'm a little nervous to go to the oncologist again because when I went last time, I was traumatized by, I went to a oncologist that deals with female cancers, whether it's uterus, whether it's cervical. It's a specialty doctor that deals with female cancers. So all the women in there, everyone lost their hair. Everyone had rags on their heads. I was the youngest patient in there, and it was hard. It was really hard. I'm going to start getting emotional now. But it was really hard to see all those people suffering, okay? And it was really hard to see people hooked up to chemo and have their own rooms and getting treated, and it sucked. It really sucked, and it scared the shit out of me, guys. I'm going to be honest. I was terrified, and I really didn't want to that to end up being me. And that's exactly why I've chose the natural route, because I want to take control of this. And I'm such a health freak already that all the research I've been doing, I see that there can be huge benefits by what you put in your body and by treating naturally. And I'm not saying there's one way is better than the other, but personally for me, that's my choice. And that's what's going to be best for me, for my lifestyle, for what I believe in. And that is it. So yeah, I'm doing better all in all. I feel amazing. A lot of my symptoms are gone. I don't have constant nausea every day. I don't have constant crampings, and this and that. So, anyways, after the biopsy, I went to get ultrasounds to also monitor some cysts we found on the uterus a couple months back, and they were a little concerned about that, but they kind of let it go, thinking cysts sometimes can heal themselves. So I went back, did a bunch of those tests, and did different types of ultrasounds, invasive and non-invasive, and they came back kind of bad news. So it wasn't necessarily connected to the cancer as much as I was a little scared about. I was thinking maybe they're tumors, like maybe what's on my uterus, like there was lumps and stuff like that, and it's kind of concerning. So they came back and told me that I had PCOS, which is polycystic ovary syndrome disease, which is a hormonal imbalance, which means I'm basically infertile, which means a lot of different things that I have to really, really watch what I put in my body when it comes to balancing out your hormones. And now I got to see a fertility specialist. I got to see a couple other specialists when it comes to that. And for me, it's kind of genetic. It's DNA derived, obviously, because a lot of PCOS people, their overall symptoms are really overweight. They don't eat very well. It's almost like borderline diabetic. You're insulin resistant. And because when you have insulin, your body spikes insulin, and it doesn't use it in the right way, and it causes your hormones to get all off balance, which causes estrogen up and progesterone and testosterone, and I can't even pronounce all of them. But yeah, it causes a lot of problems, and that is a big reason why I was dealing with nausea. And since July, I haven't had a period. And so that's been a concern. The doctors were like, why are you not getting your period for, goodness, like months and months and months and months, since the end of June, actually. So that it's been kind of like crazy, but I'm happy I finally have an answer when it comes to that. So now I got to get back to the oncologist, make that appointment, so to see what he suggests. But you guys, I really don't want to go. I just don't. I really don't. It's like pulling my hair, trying to get me in there, and I just gotta go to see what he has to say, I guess. And I feel like I'm not gonna like what he has to say, because I don't want to do chemo. I don't want to do radiation. I'm not for it. It's just not me. But we'll see. And I really don't want to take out my whole cervix. And I feel like those are the next steps he's going to suggest. So I'm terrified, you guys. And so with PCOS, I have been still doing the right diet. I've been taking extra PCOS supplements that's supposed to help balance out hormones. and help fertility. So yeah, that's gonna be like a whole nother YouTube series on figuring that out. I've never thought I was gonna be one of those women that's hard to get pregnant, that has to do all these treatments, or that has to be on medication. They're telling me I might have to be on medication every day to help the PCOS balance out and regulate it. And this is another thing, is I don't want to be on medication every day. You know, I'm trying to do this naturally. I'm literally trying to do everything I can to fight naturally with this cancer, and now I have this PCOS to worry about and the hormones, and it's already hard enough with my strict diet, like being keto, being cancer, and watching my insulin spikes on top of everything. It's just crazy. It's crazy. So yeah, I have a lot to worry about on a daily basis. So it's been tough. I have been taking CBD daily now, and that's been helping with my anxiety and anti-inflammatory properties. So I've been a little bit less like kind of bloated. Some days I feel kind of like on my lower tummy area because of the cervix, because my uterus is swelled right now, because of the PCOS. I get like kind of like uncomfortable some days, so it kind of sucks. So I have a lot of like anti-inflammatory herbs and supplements, and I like to eat a lot of things like that to help reduce those pains and that uncomfortableness. So that's where I'm at, you guys. It's been freaking crazy, huh, Bruiser? Yeah. He's been very supportive. I love my animals. I have 3 dogs and a bunny, and they really keep me happy. So yeah, that's that, you guys. I will keep you posted on everything else because it's gonna be a lot. There's a lot going on. But anyways, you guys, take care of yourself. Get to the gym. Be healthy. Don't drink alcohol. Stay away from anything toxic. And I'm gonna end it right there. Okay, bye guys.